I actually have a diagram, and I'm going to draw it up right here, and hopefully, you know, they can work their tech magic, and I'm going to narrate it as I draw it. But this is how I look at the role that public health has and the reactive healthcare system has, and they need to work together in order to make us a more healthy population. But right here you have a line, and this is where you're perfectly healthy, okay? This right here is where you're dead. And right here is your baseline here. And so if you are perfectly healthy and you're going from being healthy and you're getting sick and you're dying, right here is where infection happens. Okay? But this kind of, and again, this is very general, it's not specific to anything, but most of your diseases, if you catch it here, it's easy and cheap to treat. Okay, and as it goes up to here, it gets more and more expensive. If you're at the gates of death, it's usually going to be fairly expensive to bring you back, and that's the way healthcare works. And right here is, let's go with blue for public health, but right here is where public health really should be shining. This is where they should be talking about hygiene. Okay. This is where they should be talking about sanitation. Okay, this is sanitation, exercise, nutrition, but this is where all of this comes into play. But this is where public health should be working. This is where the CDC and the Surgeon General should be spending their efforts, okay? But they're not. They're too busy talking about drugs and pharmaceuticals and stuff like that. But this right here is the cost to treat. And I made it in green because green is obviously the color of money. So, you know, it costs more. The longer you go, the more it's going to cost. And here is where your reactive health care. This is proactive, this is reactive, and this is where your hospitals are. Your doctors, your hospitals, and doctors, they actually will work over here too, because sometimes you're not sick and you go see a doctor for a wellness visit. And the doctor says, you know, you probably should exercise a little bit more. Maybe you should, you know, eat more veggies and less Big Macs. That is all where the doctors are going over here, which they should be doing. I agree that they should be. I don't think they do enough of it. But a lot of them are just going to go put you on the little shot that you shoot in your belly and call it good until you eat what you want. And that's, again, not good. This is one of the things that really surprised me is, you know, we just discussed this, but this was the COVID advice in 2020 when they sat and said, hey, don't go into the hospital until you're nearly dead and you can't breathe. All that did was increase the amount of money it would cost you to get better. It probably saved your life if you did that too, because if you came in here, they would just throw you on a ventilator because the hospitals, and we found out after the fact that the reason why they put you on a COVID ventilator wasn't for your benefit. It wasn't for you. It was to prevent you from breathing coronaviruses all over them. And a lot of people died because of that, which I think is incredibly selfish.